Good day, and thanks for listening again. This is Dr. Dempsey On Call with Doc Dave, and this is episode number 8, Appendicitis. Again, just like the prior episode on gallbladder disease or gallstones, this is a non-essential organ, and not meaning that if you have to have this removed, it doesn't generally affect your lifestyle. It can cause some minor symptomatology, but we'll go over it later. But you can live easily without an appendix. So what is appendicitis? It's a condition where the appendix becomes inflamed and swollen and generally fills with either pus, stool, or parasites. And it can cause it to rupture and cause an abscess and peritonitis, which can be fatal. So this is something you don't want to ignore. Once the attack comes on, generally 90% of the time, it's not going to resolve spontaneously. So I will go over all the symptoms and everything, but if these things present, then you need to go to the emergency room immediately and have it looked at. So what is the pathophysiology of appendicitis? In other words, what causes it? How does it become inflamed and cause problems? Well, there's a tube that joins your appendix with your large bowel, which is called your ileum at this point of the anatomy. And this tube gets obstructed by either stool or pus or parasites, or sometimes, very rare, a tumor. And it's rare to resolve spontaneously. You definitely need to either contact your physician, or if you're unsuccessful with that, go immediately to the emergency room and have this looked at. The causes of appendicitis, it could be dietary, meaning, fatty, spicy, greasy foods like pizza, cheese, butter, fatty meats. But it's also more commonly caused by either bacteria or virus, or rarely parasites. It just gets infected. The bacteria gets in there. It develops pus in the appendix. This blocks the tube that drains the appendix, and it becomes more and more swollen. And if you don't get it looked at, usually within 48 to 72 hours, it can rupture, and there's, that pussy material will go into your abdominal cavity and cause severe, possible fatal infection in the abdominal area, which is called peritonitis. So, what are the symptoms of the onset of appendicitis? Well, generally you start to develop right lower quadrant pain. It just sort of comes on kind of insidious. It's not like a kidney stone or a gallbladder stone where boom, it just comes on immediately. Kind of comes on over a few hours. You start to feel nausea. Maybe you're gonna vomit, maybe have some diarrhea. You've lost your appetite. You may be getting a fever and maybe some weakness and lightheadedness as you get dehydrated. So it's right lower quadrant pain. Now there's some tests you can kind of do at home, but I don't really want to go over those, because I think specifically if you have these onsets, you should immediately go to the emergency room. So you get to the emergency room, what do? Well, you eventually get seen by the doctor, they start an IV, get you hydrated up, give you some analgesic, usually a little morphine, give you an antiemetic so you don't have vomiting. And then they draw some blood tests. And the main blood tests generally are your CBC, which shows an elevated white blood cell count, which is panamonic of having an infection. You'll have a low-grade fever, 100, 101, 101.5. And so they immediately take you in and do a CT of the abdomen with contrast, and that will show a swollen, inflamed, enlarged appendix. It's pretty easy to diagnose with that. So they may also give you some IV antibiotics while you're getting the CT scan and everything done as well. So how do you treat the appendicitis? Well, you do an appendectomy. It's either a laparotomy. They just make a small little incision, go in there, remove your appendix, and that's it. It's pretty quick procedure, 30 to 45 minutes. Usually go home in a day once you can start having bowel sounds and have a bowel movement and start tolerating PO fluids without nausea and vomiting. A day or two later, you can be discharged home. Now, there's some recent discussion of antibiotics alone treating appendicitis. But, that's something between you and your doctor to decide. And that's, obviously a little riskier because, if you get late with the antibiotics and it's already formed a large swollen appendix, it can rupture whether the antibiotics are there or not. So how do you prevent appendicitis? Well, mainly what you can do yourself is dietary eliminations, fatty, greasy, spicy foods. Those types of things will precipitate potential for an appendicitis. So basically that's it with your appendix. It's very similar to your gallbladder. It's all the anatomy. The tubes get obstructed. The gallbladder or the appendix begins to swell. There's bacteria in there. There's pus in there. Complications, it can rupture. Same thing as the gallbladder. Both are non-essential organs. Both can be removed. You're going to have similar kind of side effects with the appendix being removed as you did with your gallbladder, with some slight, digestive problems, little diarrhea, but nothing serious. So that's what you need to know about appendicitis. So if you like it, hit the like button. If you really like it, hit the subscribe button. And now you know how it's going to come on at home and what to do about it. And again, remember, I'm your friend, not your doctor. Always consult your doctor with any questions you may have. Thank you very much for listening, and we'll have more informative podcasts and episodes down the line. Have a nice day.